I guess we can start now. Yuvraj? Yeah.
Good evening, everyone. I'm Raj Kaushal, college head of GMC Patela. Am I audible?
Yes, you're audible. Go ahead.
So I welcome you all to today's webinar, whose topic of concern will be cervical cancer. But before starting with the webinar, I'd like to give a brief introduction of a very renowned organization, which happens to be our collaborator for this event as well. Fulkari Women of Amritsar, WOA, is the premier think tank for women in Amritsar. The organization has grown tremendously in size to become the largest women's organization in Amritsar and attracts powerful and influential women from key walks of life. It provides a platform for meaningful discussion and dialogue while empowering at various levels across different strata of society. Fulkari, as the name suggests, signifies the junction of rich and vibrant common threads woven together in complete harmony to create something exquisite. Established in 2017, it is a significant platform for the powerful women of Amritsar. Fulkari Can is the philanthropic wing of Fulkari WA. It is an endeavor to uplift society by reaching out and touching lives. The organization's focus spans several causes, including cancer, education for poorer sections of society, and environmental conservation, and helping those who are in disadvantaged positions. The following programs have been launched under the umbrella of Fulkari Can: Conquer Cancer, which is an endeavor to eliminate cervical cancer from Punjab and make Punjab the very first cervical cancer free state in India. The Learning Program. This program aims to provide knowledge to lesser privileged children and teach them moral values, good hygiene practices, as well as functional and language of English to equip them with life skills. Then comes Fulkari Green, which is a program that aims to provide and spread awareness among different strata of the society regarding good environment practices. And the program boasts a model area for learning and developing sustainable environmental practices. Then comes Help the Helpless campaign. This is an initiative to help those in need of food, ration, and other essentials in form of distributive drives, which will be in collaboration with the local government machinery. With us today, we have Dr. Richa Ghaithaman. She is professor in physiology and faculty of Department of Medical Education at SGRA Institute of Medical Sciences and Research, Amritsar. She is faculty for FEMER Fellowship Program, editor of Current Trends and Diagnosis Journal. She is also the coordinator of Medical Simulation Center and scientific head of Clinical Research Center, mentor to so many students and executive head of Fulkari Can, passionately following the cervical cancer awareness campaign. Ma'am, it is my honor to welcome you and now virtually pass over this platform to you.
Thank you so much, Yuvraj, for your kind words. And I'm looking forward to a discussion with all of you. And it is my honor and privilege to address so many prospering and upcoming doctors from all over India. Uh, I hope that you've made me the co-host so that I can share my screen here.
Yes,
Yeah.
ma'am.
Okay, great. So I think I should also say all the best to all the students. I think many of you might be having your send-up exam soon. Still, you're finding time to listen to this talk and be part of the cause, and I'm thankful to you for that. Is my are my slides visible to you?
Yes, ma'am.
Great. So this is from Fulkari Can, Care, Aid and Nurture. Just a second. So Fulkari can care, aid, and nurture. And we are knowledge partners with CAPIT. CAPIT is the Cancer Awareness, Prevention, and Early Detection. Now, this January, why we are taking so much of interest, and we've collaborated with a number of institutions, and we've talking a lot about cervical cancer during the January month is because the cervical cancer, January is the Cervical Cancer Awareness Month. And the WHO says to everyone, get informed, get screened, and get vaccinated. So just remember these three things: get informed, get screened, and get vaccinated, right? So we're ready to go. A little information. I know academically you people know a lot. This session is more about creating awareness, and we want that we can hold your hands as future doctors, and we can spread the word about cervical cancer, because this is one cancer which is preventable and can be treated. So that is why we are focusing on cervical cancer. So the point to ponder here is not all cancer is pink. Over the few decades, I think we've talked a lot about breast cancer. We've had so many awareness campaigns, making women aware about, breast cancer and all, but not all cancer is pink. While we use the pink ribbon for the breast cancer awareness, the color for the cervical cancer is teal. So this is the Fulkari Canteen team with a teal ribbon initiative. This is a beautiful teal ribbon that has been created as a monument and has been placed in January as kind of a monument and different places at Amritsar, because our focus is in Amritsar and Punjab, to create awareness for cervical cancer. And such a beautiful one has been created here. Now, the goal of the mission is to make Punjab the first cervical cancer-free state. Now, the impact to date, as far as our organization is concerned, that I think it's now 52 cervical cancer awareness sessions have been created, and 2 lakh, around 10,000 people have been made aware of the cervical cancer throughout the state of Punjab. 5 cervical cancer screening camps have been arranged, and around 420 women have been screened for free using pap smear tests. We could have arranged more cervical cancer screening camps, but because of COVID, I think we had to put a stop for it and go ahead with our online programs. Cancer can affect people of all nationalities and all age groups. The American Cancer Society says that we can use the word caution to help recognize 7 early signs of cancer. So for change in bowel or... May I request everyone to please keep your this Zoom meeting at a silent mode, just in case you've forgotten that. C is change in bowel or bladder habits. A, sore that does not heal. U, unusual bleeding on discharge. T, thickening or lump in the breasts or elsewhere. I, indigestion or difficulty in swallowing. O, obvious change in a wart or mole. And N, nagging cough or hoarseness. Let's concentrate on cervical cancer. And we talk of cervical cancer because it is the second most commonly diagnosed cancer in women, and 80% of cervical cancer is seen in the developing countries, more so because due to lack of screening in these countries. You all know about uterus, cervix, vagina, and the site for cervical cancer. Now, human papillomavirus. As far as cervical cancer is concerned, we have a lot of talk about human papillomavirus because they say around 99.7%. That's a huge amount. It's almost 100%. 99.7% cases of cervical cancer are caused by high risk human papilloma virus infection. In fact, more than 50% of sexually active men and women are infected with HPV at some time or other in their lives. And HPV, virus can infect any sexually active male or female. It comes and it can go on its own. There is no treatment as of now that is effective against HPV virus as of now. Now, what is the impact of HPV? That more than 660 million people, it's the estimated number of people around the world which are infected with HPV each year. More than 570,000 is the estimated people around the world diagnosed with HPV related cancer each year. And around 65 or more are the estimated number of people around the world which are diagnosed with HPV related cancer each hour. The number of treatment options for HPV are 0. While there may be treatments available for certain HPV related cancers and disease, there is no treatment available for HPV infection. The treatment is available for whatever happens to the body after HPV infection, but hardly any treatment for availability of HPV infection. All right, to all of you, I should remind you that you are going to have your e-certificates after the session. You will all be getting it, and of course, there's a quiz competition at the end of it. So we need a little attention so that you should, pass through the quiz with flying colors. I hope that you remember this. Do you remember the quiz competition? All right. All right, we know that HPV causes more than cervical cancer. Almost 99.7, that is almost 100% of cervical cancer cases are because of HPV infection. Around 40% is the vulvar cancers are caused by HPV. 60 to 90% of vaginal cancers are caused by HPV. 80+% anal cancers. Now, around 100% genital warts are because of HPV. Head and neck cancer, also oropharyngeal cancers, which again have become an important point of discussion, 12 to 70% due to HPV. Penile cancers, 45% due to HPV. So HPV, we've talking about coronavirus so much, but think about HPV infection. So many of cancers are attributed to infection by HPV infection. And there are books which quote that there are around 100 different types of HPV. Certain books quote there are 200 different types of HPV, but of course there are around 100 to 120 different types of HPV. And if we talk about the genital types of HPV, there are around 40 or more types of HPV which can and few of them can cause cancer. And the women in the age group of 55 to 65 are more vulnerable to get cervical cancer. They are at highest risk to get cervical cancer. Now, this is the data which is shown. Just have a look at 5,000 in Pakistan, 120,000 in India, and so on. So look at the statistics in India per year of cervical cancer women. So more than 200 women die every day of cervical cancer. 8 women, this is India, 8 women die every hour. And every 7 to 8 women, 1 woman dies of cervical cancer. And that also, we are talking about a cancer which can be cured, which can be treated, but we just have to follow a few things. And that is why we are focusing on it, because this is a totally preventable, treatable kind of a cancer. Which other cancer is totally treatable or preventable? Hardly any. So it is important that we pay attention to this type of cancer. And of course, this cancer can be both in women and men, but of course, we're concentrating more on women. Also, when we talk about cervical cancer, then cervical cancer kills around, roughly around 68,000 Indian women annually. And the type of HPV, we were talking about the types of HPV. There are 16, 18, 9, 11, which are more virulent. And it is the mainly type 16 and 18 type, which is responsible for 82% of cervical cancer cases. Now, when the patients who come to you, they have various symptoms. They can be unusual bleeding, uh, or they have menopause, and after menopause suddenly certain bleeding starts, or there might be certain unpleasant. So whenever a woman comes to you menopausal age or after menopause and complains about that the bleeding has started again, or there is abnormal kind of bleeding, just do think about cervical cancer and ask that lady to go for cervical cancer screening. Remember that. Then there can be unpleasant vaginal discharge. So there may be discomfort or pain during sex. There can be swelling or one of your legs. So these can be late symptoms that the cervical cancer is already there, and there are secondaries, and you have swelling, or lymph nodes are involved. There are swellings of one of your legs. There can be bone pain or change in the bowel habits. Facts about HPV infection. The HPV infection, it starts, there are low grade HPV infection, or they can be highly invasive type of HPV viruses. So in 1 to 2 years, there might be HPV infection, or there might be low-grade lesions. In 0 to 5 years, they can be low-grade or they can be high-grade lesion. So it takes 1 to 20 years to have invasive type of.
If the word doesn't come on Google, ka dictionary doesn't count.
Come on, Avi, is it Avi? Is anybody's
No,
message
ma'am.
of? Okay,
I'll
okay,
just
okay.
I'll just ask
Yeah,
the
yeah, yeah.
host to mute everyone else, please.
Yeah. It's fine. No worries. So we have invasive cancer, which comes around 1 to 20 years. So it takes a lot of time to develop cervical cancer. So we have a lot of time in between to vaccinate and screen women so that the cancer does not reach the invasive cancer stage. And remember, most of the HPV infection can go away on its own, but some might progress to low grade, high grade, or invasive cancer. Yeah. Now, informed, get information. You already, all of you have information. I've given you a little more information about cervical cancer, or I have just, uh, brushed up your information again. But let's talk about vaccination. Do you know about vaccination? Which vaccination is to be given and how the doses are to be given? Type yes if you know, and type no in the chat box if you do not know. Type yes in the box if you know about how to, whether you know about the vaccination, or type no if you do not know what type of vaccines are to be used and what frequency. Yes, no. Okay. Okay, great. So let's brush it up once again. Oh, I'm so sorry. Okay, there are two types of vaccines which are available. One is Cervarix. This is from the GlaxoSmith company, this vaccine. And this vaccine is effective against HPV 16 and 18, which are mainly responsible for the cervical cancer, most of the cases. Gardasil is the vaccine which is by the Merck company, and it is effective against HPV type 16, 18, 6, and 11. Mostly cervical cancer is caused by 16 and 18 types of HPV types, but 6 and 11 are also responsible for genital warts. So once this vaccination is given, what you see is the genital warts starts getting less in patients who are already having that. So I feel this Gardasil is slightly better than Cervarix in that capacity. So vaccination, how to give vaccination and whom to give vaccination and what age to give vaccination. Now, dose scheduled for HPV vaccine, age in during 9 to 14 years of age, and we are talking about both men and women, both girls and boys, of course, given more in girls. So 9 to 14 years, 2 doses are to be given at 0 months and 6 months. If the girl is 15 years to 45 years, then we recommend 3 doses, 0 months, 2 months, or 6 months. Certain books also say 0 months, 1 month, and 6 months, but it is preferably 0 month at 2 months and 6 months. Now, what is important? It is important that the girls should be vaccinated at around 11 to 12 years of age before they start into any sexual activity, because in certain areas, certain girls might become sexually active at a younger age. But still, 2 doses are important till 14 years of age. And even if there is some sexual contact, it is still advisable to give cervical vaccination, because the person might become infected by HPV by the sexual contact, or might not become infected by HPV by sexual contact. Moreover, even though HPV infection is there in women who become sexually active at a younger age, still what happens is that there are certain other HPV types which might respond to these vaccinations. So it is important to take HPV vaccine. So please, this is an awareness program where we ask every one of you to ask people around you, and also to reflect back that vaccination is important. And we as budding doctors give it a thought that this vaccination can prevent cervical cancer. Prevent cervical cancer. All right, American Cancer Society guideline says, now what we come to is, we've talked about vaccination. Now we come to the screening. When we come to the screening might start at age 21. So if the screening starts at age 21 to 29, then simple PAP test or PAP smear, whatever you call, every 3 years can be done as a screening from 21 to 29 years. What is recommended more is to get screening by 30 years and beyond. So if the women is 30 years or more than that, then PAP test should be done in combination with the human papillomavirus test. So this is a co-test, and this co-test, if done together, then every 5 years this test needs to be repeated. PAP test alone 21 to 29 years, PAP test alone for 3 years, PAP test plus HPV test every 5 years until the women turns 65. If the woman is 60 to 65 years, if only PAP test is required, if only PAP test is done, then it has to be done every 3 years. I hope this is clear then now to all of you. Now, this is one data that was collected from Mumbai women. And what is the health impact of screening and health impact of vaccination followed by screening and vaccination? All right. Now here we have the age, and here we have the cancer reduction percentage. Now just have a look at this. This is interesting. If we have vaccination alone, I think the colors are given wrong, but if the person or the female is vaccinated alone, then the cancer reduction is to the tune of 44%. If the person is only screened, if the person is screened once at 40 years, the cancer reduction percentage is 13%. If twice at 35 and 40 years, then cancer reduction is 21%. If thrice at 35, 40 and 45 years, the cancer reduction is 29%. But if vaccination is followed by screening, then the cancer reduction, if done once the vaccination is done plus screening at 45 years, the cancer reduction is 52%. If vaccination is given and screening is done as 35 to 40 years, the reduction rate is 56%. And if it is done thrice, vaccination followed by screening, the cancer reduction is 61%. So I think from this simple graph, it is so evident that vaccination alone is important to reduce the cancer reduction by 44%. But if vaccination plus screening is allowed, there is so much reduction in cancer in women. Okay, to combat cervical cancer, what we need to do is what we need to do is pap smear or pap test and HPV test. We need to think about HPV vaccine preferably at a younger age. Please, even if the HPV vaccination is not given at a younger age, please do take the HPV vaccination till 45 years of age. Practice safe sex, preferably use condom. Quit smoking. We talked about that HPV infection is responsible for 99.7% of cases, but smokers, women who smoke, also have increased few percentage of cervical cancer is because of smoking. So a healthy lifestyle is also important. Stay in shape, limit sex partners, do not ignore the family history. Yes, family history is very important. Anybody who's just mummy or masi or nani or dadi, they have cervical cancer, please be very, very aware. Vaccination and screening is very important for those women. Keep an eye on symptoms. Consume foods that nourish the cervix, strengthen the immune system. Let's watch this small clip from WHO till we say au revoir, goodbye till we meet again. Oh my God. Yes. For the first time ever. Can you see it? Anyone?
Ma'am, the screen isn't visible.
Excuse me, ma'am, are we audible?
It's not audible?
Ma'am, actually your screen is visible. The video isn't. It's the presentation which is still visible.
I don't know, but the gist of the story is
Ma'am, you can try from the share screen option. There is an option over there. What exactly do you want to share? There should be an arrow besides this. Once you share screen, you'll get an. What exactly do you want to share on your computer?
No, but I've shared the screen. You can see the screen, but you cannot hear it. Is it correct?
No, ma'am, we cannot see the video as well. We can just see the presentation screen.
Okay. So what do I do then?
Ma'am, you can share screen, and then if this is working on Google Chrome or something, you have to select that window.
I should share this.
Richard, to turn on volume, you need to restart your screen sharing. When you start screen sharing, there will be an option for volume at the bottom. And then you click that on for audio to be activated, and then that works. Without that, it will not, the audio will not work with the PPT.
Is it audible now?
No, you need to restart screen sharing.
All right, I'll try once again. Is it visible now, Mansamar?
Yes, ma'am. The screen is visible,
Yes,
but
it's
the
visible.
volume is very low.
Excuse me, ma'am. There's a suggestion in place in case you can turn on the closed captions. If it is not audible, they can read it and you can turn on the video again. If it is on
Just
YouTube.
just a second. All right, I'll just escape this. You can see this on Twitter from WHO. It simply says that I think if 90% by 2030, if 90% of the girls are vaccinated, 70% of women are screened, and 90% of the women are treated, then I think cervical, we can, decrease the number of patients who are, uh, dying from cervical cancer. So that is the big news from there. Can you see my screen for the slideshow? Is it visible?
Yes, ma'am, it's visible.
Okay, so the carry home message is that the cervical cancer can be prevented and cured. Vaccination is the key in early years of life, 9 to 14 years. Vaccination from 15 to 45 years, plus screening 30 years onwards and follow up for later years. So the message to all of you who are here at present is get vaccinated. I just want to know, please write in the chat box if any of you who all are vaccinated, HPV vaccine. I just want to know, say yes if anybody is vaccinated. Great. So Savani, Ria, both are vaccinated. To all of you who are not vaccinated, I would say, whatever your age, go for vaccination. Of course, you are more than 15 years. So when we talk about vaccination, you will have 3 doses of vaccine, 0 months, 2 months, and 6 months. Go to your healthcare provider, go to your doctor whenever you have time, get yourself vaccinated, right? Tell your mothers, your elders, your aunts, your maids, your sisters who are elder to get screened. Please do, and follow it up as a cause. And please, WHO says, get information. Now that you have information and your budding doctors provide this information to other people, get vaccinated, tell other people who are the right age to get vaccinated and get screened. Help people, and as you grow, stand by this cause because cervical cancer is preventable. Please follow it up. Let's go forward for cervical free state and India, and let's make it a reality. Thank you so much. I don't know, it is not coming forward. There was only one slide of thank you. So thank you so much. I had a wonderful session with you. If there are any questions, we can. Yeah, Mansiva. Are there any questions?
Thank you so much, ma'am.
Yeah.
Yeah, there's one question from Asma. Is screening same for immunocompromised women as well?
Yeah, screening will be same. Vaccination, we still have some certain question marks for immunocompromised patients, and in people who are allergic to yeast or allergic to certain type of things, so you have to specially go to the doctor to ask about it. But screening will be same because screening is the pap test as well as the HPV test. So screening anybody can go ahead with. or can go to the gynecologist for more detailed information if there is a need. And yeah, for I think people with AIDS and immunocompromised, it is even more important to go for screening.
That is all, I guess. Do we have any questions? You guys can send in the chat box if you have.
I just want to ask you, was this session helpful in the sense that except for the information which you already some people might be having, it was more like an awareness session. Do you think that you can take it up as a cause? I mean, I don't say that you go after it because you're busy with your own things. Do you think it is worthwhile taking this cause forward, being it a preventable disease?
Um, uh, yeah, yes, ma'am. I think we like it is a really good thing that you guys are doing, spreading awareness about something that is preventable. Like these like it is very helpful for us to know about the vaccination, because I myself wasn't even aware. I was aware that there is some vaccination, but I wasn't aware what the schedule is, or what till what age can I get a vaccination. So it is very important for us to know at least like what all things are available, and how should we go about it. And like yes, we can definitely recommend this to our sisters or mothers to get screened as well.
One thing I just want to add is that the Punjab, it started with the cervical cancer, a kind of a pilot project 2016 or 2017. I think Dr. Winnie Mahajan was the, I think, health secretary then, and with Dr. Soumya Swaminathan, who's with the WHO at present. But then I think it stopped after that. And what is more important is that the vaccination is around, say, 2,500 to 3,000 rupees. So there are certain, financial constraints on the state government and whether they can take it up into their immunization schedule, or they can collaborate with the Global Alliance for Vaccines and Immunization and get it as a subsidized rate. Because what is more important for us is whether the vaccine, the efficacy of the vaccine, safety of the vaccine, and the third point is cost effectiveness. So let us wait and watch what the state government, plans about it.
Yes, ma'am.
That's from my
Okay.
end.
Yeah, we have one more question. How we manage this during pregnancy?
Whether screening or I think screening, they should wait for, as far as screening is concerned, they can wait for a few months as far as screening is concerned. But I think if pap test it is easy. Pap test can be done during क्या कहते हैं, pregnancy as well. But if there is no rush to do it, the pregnancy should finish off. The best time to tell a woman to have screening is postpartum. Postpartum is the best time to tell a woman to go off for screening, because her mind is alert during that time, because she just delivered a baby, her health is at prime importance. And as far as vaccination is concerned, it is preferable not to give vaccination to women who is pregnant, because a lot of clinical trials have not gone during pregnancy. But a few women who have got immunized during the pregnancy period, no untoward incident has been reported. But it is advisable that the vaccination should be done post pregnancy.
Okay. I hope this helps, Asma. Okay, one more question. If the disease is transmitted by sexual contact with the males, so is it not important for the males to get vaccinated as well?
Yeah, there is we've talked about it, that there are certain cancers which are also, penile cancers are also seen in males, warts are also seen in males. So cancer can also occur in males, of course not cervical cancer, but of course it is advised that the men should also have cervical vaccine. Even children, young children who are males, boys are advised to have this. And one more thing I would want to add: a few days ago in a Hindi newspaper, there was in a news that there was a patient, a pregnant woman who had cervical cancer, and she delivered twin children. And both children, over a period of time, one developed cervical cancer and the other developed some other type of cancer. And that means that cancer, that means certain cancer cells from the mother were through the blood during the delivery, it were transmitted to the babies, to the fetus, and then to the, I think, to the infant or the newborn, and therefore they develop cancer later on. So a lot of studies are still have to be done, that how all this happens, but it is important if the vaccination is given in time. So this will help, vaccination plus screening.
Okay. If advanced cancer and treatment can't be delayed, should pregnancy be terminated?
Well, I'm not the right person to tell you about it. A gynecologist or an oncologist or a person, a radiotherapy will tell you what exactly or what treatments are available, which are safe in women who are having pregnancy and still need treatment for cervical cancer. Yeah, I told you that young boys can have or should have, in fact, the cervical vaccine. No, sorry, HPV vaccine.
Okay, so I guess that is all. Uh, we have no more questions.
Thank
So
you,
thank you so
Principal.
much, ma'am, for the amazing session. And it is a really commendable job you all are doing at Sulkari Can. And
I'll just
yeah.
address one more questions. I don't know what the person is. If you have time, otherwise you can. I think the session is already late, so you can.
Yeah, we just.
Yeah.
Okay, so we have our Vice Overall Chairperson Internal with us, Dr. Ravi Singh. So would you like to say a few words, Dr. Ravi?
Am I audible, Mansima?
Yeah.
Hi, ma'am. Good evening, ma'am.
Hi.
I it's at most times when I'm at this place, I am talking to someone I don't know, but today I think it's the biggest pleasure for me to be able to hear you, and it was such an easier job for all of us because we already get inspired a lot from you. For a lot of people who don't know ma'am, I think all of Amritsar, all of Punjab can tell like she's one of the most proactive people that we have. I am not from ma'am's college, but she's helped do so many amazing events in the capacity for helping students especially. But to see this, that what we can do is such a pleasure, ma'am. And so just not going there were a few points that I tried to gather because ma'am, you've already obviously covered everything relevant. This the best thing that I could absorb from the campaign was that it wasn't an academic session as much, but more about being an awareness campaign. Because what we do is, as medical students, we are aware about everything. Like we know the staging of the cancer, we know the treatment of the cancer, but we fail to recognize that we have an obligation, a responsibility as a medical professional to spread the awareness. Like even if our own parents, our own mother comes to a complaint, the first reaction that we have is, oh, kuch nahi hai, koi zarurat nahi hai doctor ke paas jane ki. But we're studying this the exact opposite thing. So I think that is really important, and thank you so much especially for that, ma'am. I think we have come a long way. Like when we were in our own first years, when I used to hear cervical cancer, what used to come to my mind was cancer of the neck. And I think from there we've come a long way, and step one has been already
Black tea?
laid with this month. Can you mute them? Yeah. After that, I think one important message that again ma'am has been giving, and I want to just reinstate that screening is super important, and it's very important to understand that screening happens before the disease. You are not supposed to wait for the disease to happen. So if you're apparently healthy, you have to get screened, right? And the the fact that why this campaign is, I'm sure, going to be super successful, and Punjab is going to be the first state, and it's going to spread nationally, internationally, is because we have concrete proof in front of us. Cervical cancer used to be the most common cancer in females, especially in the US at one time, like not 3 decades back from now. And today, just due to successful, effective screening, it's been left behind. It's very low in terms of mortality. Whereas in India, it still is one of the commonest cancers in female. So I think we have an example to look up to and how things can change. And ma'am, one thing that I want to congratulate you on, that this campaign obviously was based in Amritsar. it grew into a national campaign. We have people from everywhere, which I think can help you take this stride much forward. But a beautiful thing that I want to tell you is like Asma, who's been asking the most questions to you as of now, she is from Kyrgyzstan. So this campaign is not just national, it's an international campaign that you've taken ahead. So thank you to you, and thank you, Asma, for being such an active participant. Uh, Also, I tried to find a teal ribbon. I could not. So the only thing I could find was a teal turban, and that is why I've tried that. Just take this. Let's just take this message ahead, because Fulkari can. And from all of AMSA, I would really want to congratulate you. And there's a little something that we would want to provide you at the end of this session, a letter of appreciation, because although I know how amazingly work has been done by you in a professional capacity, I think I cannot do anything less or more than that. So Mansimar, just let me know if you can get ma'am's email, and we'll send ma'am the official letter of appreciation. And thank you once again, Dr. Richa. It's been such a pleasure once again.
Just 1 minute I'll take. Avi, I don't want to speak too highly of you. I've already spoken on many platforms. And Avi is too good, and I think all students know it. He conducts beautiful quizzes. I've seen it all. He's first in final year and everything. Too many things. I don't want to put it. And you have very good words to say, but I think I'm just speaking. I'm behind have is the Fulkari team. We have Paneet, we have Nidhi Sidwani, we have Priyanka, we have Sheetal. We have so many people. We have Deepa, and we have kept it at our back. Who are really doing something. I'm just putting up this session and just providing them with a little bit of support, but they are doing immensely so many things. And January has been, uh, you know so busy for them, spreading this awareness. And if you students are with us, I think we can take it forward. We don't need to spend anything. We just have to get forward and create this awareness. And if you're with us, I think no looking back. Yeah, Asma, thank you so much for being a part of it. You're welcome to be part of the online program here in India, and of course all the students who are from India. Yeah, it's your turn now.
Thank you. And from all of AMSA India, ma'am, I would want to say that anytime you need any help in any capacity to help get it across, I think it's our responsibility, but we are always, always there for you. Handing this over back to Mansimar, I would just like to take a second to congratulate Yuvraj, Manan, Tarika, and Mansimar, who have been so beautifully managing all of this and getting it in front of you. So you guys are the best. I don't have to tell you that. Over to you, Mansimar.
Thank you so much. And thank you, ma'am, for the
Mansimar
amazing
is a
session.
sweetheart. She's my mentee, so I don't. She's a beautiful girl, inside out. Helped me
Thank you,
many more times before also.
Thank you so much, ma'am. Okay, so now we'll be moving on to the quiz part, and we'll be sending the code in the group in about 5 to 7 minutes. And